So, as we're unwinding from our workshop, I'd like to introduce our next panel discussion. The panel discussion is titled Sweden's Next Steps Around Self-Determination in Gender Affirming Care, a conversation with organizations. It is moderated by Jas Montanu, with returning speakers Leo Gustafsson, Frank Berglund, Purity Tukwasi-Webb, Angelica Lödvin, Helle Berglund, Vilmos, Hanna Tessen, and Max Högqvist. THP is represented by Gabrielle Blockert. And just give me a bit of time to introduce the new people joining us. So Yas uses they them pronouns and has over 10 years of experience from the LGBTIA organizations RFSL, RFSL Ungdom, SFQ Uppsala, and IGLU. Yas is currently working as a journalist and editor-in-chief for the student newspaper Spionen. And Gabrielle uses she/her pronouns, has worked with THP and other groups in organizing, documenting, and attending meetings with Socialstyrelsen on the topic of improving access to self-determination. This panel discussion poses the question, what if self-determination becomes a medical right? What are the possibilities and which obstacles do we face? Which ways can we take forward and where do we stand now? So I yield the floor to you. Just give us one extra second to get settled in.
Hello. Hey, there you are. Thanks a million. Thank you, organizers, for a great job. We have short of time, so I'm going to get further. You got the presentation of all these people representing different organizations. And today we're going to speak about self-determination in the transgender healthcare. So I would like to give you one minute to start with, to just take forward any insights you've had during the day when it comes to your future advocacy for transgender rights. So I'll give you like approximately 1 minute each. Is that okay? Okay, I'm gonna time you. So yeah, go on. You have some mics here. Let's take these mics, okay? Whoop. And I think, so, do you wanna go first?
Repeat the question again?
Yeah, so during the day, what have you learned? Like, have you had any like aha experiences for your future work in trans healthcare?
Well, what I have learned today is that we are all fighting for the same cause, and I think a future healthcare that we deserve might be possible. It might not be now, but with all these minds and with everybody who has given a presentation, you can tell that it should have happened like yesterday, but now we are having these conversations, and the future looks great if we still continue dreaming. It might not be when I'm still alive, I don't know, but it could be possible. But for now, it is still going to be a road for all of us to achieve that.
Thank you. Sorry, should we pass on the mic to Frank? This is, okay, we shouldn't shut them off, maybe. Okay, Frank, go ahead. Yeah.
Thank you. Yeah, I've been really inspired hearing a lot of different voices and experiences, and I feel like it's so important for us to meet as like trans communities and allies and like push further our ideas of like gender and what is healthcare and stuff. Yeah, I'm thinking a lot about like the difference between like healthcare, like within the healthcare system, and what is like care and health that we like provide for each other. And yeah, I'm a bit like stuck in like the practical, like I want like healthcare practitioners in the room and like exposing them to these ideas and challenging ourselves as communities as well, and learning from the healthcare practitioners and the politicians who are the ones who are like systemically down prioritizing our healthcare, getting them in the room as well. So yeah, that's where I'm at. I'm glad that we're meeting as a community, and I'm lacking the voices from the people actually in power.
Thank you. Gabriel?
Hello. Well, I would say that the most important thing that I've learned is the importance of intersectionality, especially how like voices from, for example, neurodivergent people or people of color, etc., like helps in like advancing the discussion on everyone's needs, and especially how like the activism that we're doing and the goals that we're trying to reach are impossible to reach without considering those voices as well.
Thank you. So when
Upp med den här lilla svarta. Yep.
Yeah, I can just switch it. Okay. So one thing I really loved about today was we talked about love in various different panels, and like the very positive things about being in this community. We talk a lot about how terrible everything is and all the way the world is against us. And unfortunately we have to, because we have to talk about those things to change the world. But if we only talk about how miserable we are, we're just going to stay being miserable. So it's really important to talk about how much you love being a trans person, the love you receive from your community. It's a type of love that I think you don't get anywhere else, because it's so freeing and unconditional. And I'm really going to bring that with me and continue talking about the very positive parts of the trans experience.
Well, I've learned several things on different levels. At the structural level, something which I learned when I came out in London, and I learned there, they say, minorities must stick together. And it's still valid, because we must stick together. We can have different opinions on different things, but we must stick together, because otherwise we won't be strong enough. And at the structural level, I also learned more about the way a system can be turned upside down. I'm still wondering what happened in Catalonia. That all the details, because there must be a tactics there, or strategy, how to go about it. Because if you look at the Swedish system, you have, you know, all organizations, all political parties. You have the regional administrations, and you have the parliament, and you have the National Board of Health. You have lots of things, and all these, you must influence all these in the same way, and there must have been something like that also in Catalonia. So that's I'm still puzzling about it.
Thank you, Angelica.
And I want to say also, I learned a lot more about the concept of non-binary and neurodivergent, and how they stick together. It was, well, real learning about things which are far away from my where I normally belong. Yep.
Thank you. Leo?
Yep, thank you. What I'm taking with me from today is that we need to cooperate more between our organizations. We work in different ways, and we have different goals sometimes, but also we have the same goal as well. And I think we need to reach out to each other more and talk to each other and see what can we do together. and also raise each other in different kind of ways.
Yeah, I'm really jumping on to what you said. I feel like we sometimes work in very isolated islands and are sometimes quite separated from each other, even though we are working towards the same goal. So I'm taking with me that this is an example of how we can teach and learn from each other, and that we should make this more often, these kind of rooms together. Yes.
Thank you. And we have one left here.
Yeah. The one thing that I think stands out on this conference compared to last year is that last year a lot of talk was about new laws, and it felt like many of us were having the same opinions, maybe different ways to go about them, but it was great for feeling seen and stuff like that. But we didn't have the what we have this year. That I feel we are very diverse, and I feel that organizations that I didn't know of, or struggles that I haven't thought much of, or I see that hey, there's people actually working on that piece, and we have so much strength in our diversity, and I think that's great.
Okay, thank you. I just wanted to jump into the subject. I know we are supposed to speak about self-determination, but I just wanted to give everyone the opportunity to say what they're taking with them. I'm just stopping my timing here. Okay, so basically, I would let the paper fly. I just wanted to say that I think we all here can agree that we want to improve the transgender healthcare and the situation and the rights for transgender people in Sweden and around the world. But maybe we want to do that in different ways. And I just wanted to say that we can keep a respectful tone when we are speaking here today. And now I want to give you the word, and maybe you can say some short words about how your organization works, if they work to support a legal gender recognition based on self-determination. Would that be okay? Anyone who wants to start off? You've got some questions here from the start. I think maybe should we start from the back? Do you wanna start off? Sorry, I'm being a bit unclear. Helle, would you like to start? No. Okay. So I think Leo wants to start. I see.
Wow, thank you.
I see Leo is blinking towards me.
Well, I think for RFSL we are quite, we're not as progressive as some other organizations, but of course we think that the legal gender should be based on self-determination, and also that there should be at least three legal genders. So we have a lot to work on.
Thank you. Yep, just pass it.
Yes, FPS. Of course, we think that legal gender recognition should be based on self-determination, and that Sweden should take a look at the other Scandinavian countries. Of course, I mean, Scandinavia. We belong to the same sort of culture. So what's going on in the other countries can be taken over. And has anybody heard that Norway, Denmark, and Finland are breaking down because of the total self-determination? I think we should stress that point. Yes.
Thank you, Marion.
Yeah. So of course, we think that legal gender should be based entirely on self-determination. The change that we had in April was a big step in the right direction, but not far enough. And a third legal gender as well, of course. We've been working towards that goal for, I want to say, 20 years, probably, a very long time. And we will continue working towards that goal for as long as we need to, because it's that important.
Transhälsoplatformen fully supports legal gender based on self-determination.
Yes, the patient association as well, of course. Our main argument is not only that it's a human right, of course, to identify as you wish on your legal paper, but also that it takes up so much resources from the healthcare to do these evaluations. Already around the different gender assessment teams around Sweden, the wait for a first visit is around like at least 3 years, upwards towards 5 years in a lot of places. And Anova in Stockholm did like a thorough research around like, okay, how much time do we spend on the documents to Rättsliga rådet before the legal change? And they used like 25% of their resources doing medically unnecessary stuff just to like get the check marks in the law. And even though it's like a better law now, there will still need to be like a medical intervention. Like you will need a paper from a doctor, and Socialstyrelsen is like deciding how that's going to work, but we're advocating hard for that it shouldn't be only like psychiatrists and psychologists who are allowed to write these documents, but that it should also be nurses, the like school therapists, and like other like easily accessible resources to, especially to young people. Yeah, so you don't have to like wait in line for years just to get that paper as well.
Thank you.
As Creation Media and as an organization for BIPOC trans refugees, we definitely support self-legal gender recognition. But then this is, for us, it is an emergency. We are refugees, and the reason why we are refugees is because of who we are. And so for somebody within our diverse and intersectional groups, we have sex workers who are refugees. We have definitely all of us who we are. And so the more we have to depend on somebody having to decide on even simple things as like, you know, changing your name. It's like I have ran away all these miles to come to Sweden, a white country, and then again, I don't know exactly what I want. So if you want to think about self-determination when it comes to legal gender recognition, think about us, use us as your research as you always do, and ask yourselves, why would even people, trans persons, leave their homes and go to other countries? Everybody's migrating these days when it comes to trans people. It's just because we are lacking those. So if there is a space, if the healthcare has given us a space to thrive, to transition, they should also trust us and give us you know, a chance to finally determine for ourselves. You know, we live for somebody else. Our bodies are living like, sometimes when I go to a psychologist, I am sitting there and I'm like, oh, wow, this is sheer gatekeeping. And I look at it and I'm like, oh my goodness, does she even know exactly what she's talking about? Or it's just like, oh wow, I am so sorry for what you have to go through. I only want my name changed, and I don't need you to be sorry. Just let me be, you know. And so for us, it's an urgency, and also representing trans refugees who are sex workers. For them, their work needs urgency to be recognized, not to be really suffering all these other frustrations they get through their work. So for us, it is an emergency, and we can't wait to to see sitting on a table where everybody agrees that self-determination is actually who we are, and nobody else deserves to be determining that on our behalf.
Thank you, Purity. Time for an applause there. Yeah, Helle.
Yeah, thank you. It's SIB. We also support self-determination, and we think that the laws for this are kind of already in place, but we're not included because the Swedish Health and Medical Care Act actually says that no matter if you're all the people in Sweden, not just citizens and not just people who have undergone some kind of utredning, all of those people should receive the medical care they need, and it should build on respect for the patient's self-determination, and well, it's in the law. It just don't apply to us because we're not the right kind of people. So.
Okay, so I think we all can agree on self-determination, but the way to do it, and when it comes to the decentralization of the trans healthcare, maybe we have different opinions. I was thinking about what you said there, Frank, about the next step in the process, like that we still have a medical intervention to come, that we need a paper from a healthcare employee, from someone with a legitimation within the health system that can say, like, yeah, you can switch, you can change, you can, yeah. What would be the way to achieve that, like going from the transgender healthcare being within the psychiatry today and going to take that process into the prime care, primärvården? Would you like to answer that? Yes, Leo or Frank? Go ahead.
Like, do you mean like the gender, like the utredning?
Yes.
Because you can't do that
No.
in the primary healthcare.
No,
It's
exactly.
National NHV now, which means that it's in specialized centers, and it's the same amount of teams as before this change, but it's changing in the way that the purpose of it is to make it more equal around the country, so that every team needs to do the same things. Everyone needs to shape up a bit. You can't have that one or two of the teams are really, really good and the rest are really bad. And they're also supposed to like coordinate their work through the queues, or like the waiting times. It's like research is going to happen like within and adjacent to the teams. So I think there's a lot of like positive like possibilities there. The main like threat to the quality of the healthcare is the financing. So that's still that it's so underfinanced. Yeah, I think again it's like Stockholm examples, because they are the only ones that I know have like counted this way, is that they need like 700% of the resources that they have now, like 700% more to just clear the queue. So no one else can like be added to the list, and then like still 700, and then they can like work it off.
But just to be clear, that for everyone to understand, so the money going to the special teams, are they different depending on which region the team is within?
Yes, but the regions have like a deal like a contract with the Socialstyrelsen, the health agencies, where they promise that they need to like have a certain amount of different professions in these teams, and it's also like some things you can only get through the teams, like it's very specified now, but then you will be able to get some things outside of the teams, which might be good. But then you come into the question of like, okay, the primary healthcare. Like I get that like the desire to have like the system in similar to Spain or Germany, where you go to your ordinary healthcare profession, like your vårdcentral, and like get the healthcare there. But I don't think you've met 99.99% of vårdcentral staff. Like there's no knowledge there. They don't have the knowledge of like hormone interventions and yeah, so they're but the health agency has also produced like training materials for the primary care to like prepare them for this. But we also have like the national healthcare crisis in Sweden. Like it's yeah, that's what I'm getting back to. Like, what is the fault of the teams? What is the fault of the like regional politicians? What is the health agency? What is like individuals in the primary healthcare? What is our government's right-wing nationalistic politics? Like it's.
But do we have a middle way to go there? I mean, because when we were talking earlier before this panel, we were talking about, for example, hormone therapy. Like, would that be a way to go to get like the primary care to fill in for that need? And when in the process, because I mean, if you are in a cis woman in your menopause, you will get help with hormones, for example. But
yes.
Transgender people don't.
But what it's in the new system, you get the diagnosis and like the startup of your hormone therapy through the specialized teams, and then you get the rest from your like home healthcare team. So that's also like a possibility of like them also learning more through that process, and yeah, you won't have to like go to like every appointment to the specialized teams, but yeah, a lot of regions, I think Gothenburg does this as well, where like if you have like been on hormones for a while, like a couple of years, and it's been fine, then you get it through your primary healthcare instead, so you like get written out.
Thank you. And if you other panelists want to fill in, you can just raise your hand, and I'll put you on the list. I think Leo wants to say something.
Yeah, but I thought you asked further questions about the legal thing, so maybe I misunderstood your question. Can you repeat it?
Sorry, come again.
Could you repeat your question? Because I thought that you asked further questions about the legal gender change, but this was another question.
Yeah, I think I was stating two questions in one. Sorry, I was being a bit unclear, but I think Frank clarified here, because I just wanted to take in like if your organization supports a decentralization of the trans health system, like going from the specialist healthcare to like decentralize the system, go closer to the Spanish model, Catalonian model. Sorry. Do you hear what I say? No.
Yes, yes, I do. But
yeah.
But I raised my hand because I wanted to add something about legal
go ahead.
recognition.
Go ahead.
But because the thing is that the latest proposal from Socialstyrelsen is that you will have some kind of, you will need some kind of letter from a licensed healthcare professional. So it won't be only psychologists or psychiatrists, it can also be a doctor, or it can be a counselor, a health sjukvårdskurator. And that is good because those can also work, or a barnmorska, a licensed midwife.
No, it's own.
No?
Yeah, I think we... Go ahead, Frank.
It's only doctor, psychiatrist, psychologist, and therapist.
Okay. no, not therapist.
No,
Counselor.
counselor.
Yeah, counselor. Okay, sorry. Yeah. So, and that is good because a lot of those work at the youth clinics, in example, and also they can work at the like RFSL and so on. But we would also like to see a step where this letter isn't needed at all, of course.
Okay, but just to be clear here, so if you are a psychologist within, like not the specialized team, you can still give this paper. You don't need to be a part of this specialized team.
The specialized team that work with trans healthcare will probably say we don't write these letters. Primary healthcare facilities should be doing this. And that is also because you shouldn't have to wait in line for several years if that is the only thing that you need, the only thing. And that is good.
But is there a plan on how that would go? Like, I'm just
Yes.
hearing your voice, like when you go to the prime care and you can meet a doctor that is just, anyhow, you all know.
But
How will the prime care be educated in order to be able to meet our needs?
They will have like a form that the caregiver like fills out, like checks the boxes and sign. And they will also like the health agency is also working on like a letter or like a brochure or something that you can bring to like explain that like, no, you as a physician signing this are not responsible for like my gender affirming care now. Like you haven't done this huge investigation. Just like defining that it's meant to be like 1 or 2 conversations at most, and you shouldn't have to like prove anything or like tell like everything about your childhood or like your traumas or anything. Just stating that you want it and that you're aware of what it means, basically.
And from what I know, the trans healthcare teams also will like send something out to the primary care to say this is your responsibility. Don't refer them to us. That we will see if that will happen, of course. But yeah, they are aware of this problem.
Yeah, that's also like a thing with like low trans competence within the primary care today. That in some regions the like very, very long waiting times is also because like a trans person with like who has also like very severe migraines applies for like healthcare for the migraines, and the primary care is like, whoa, you need to see the trans teams, and then you like get put in the wait even though you don't have a need for gender affirming care. So that's also like something that's they're trying to like fix with the centralized care system now, that like the people who want and need and are interested in gender affirming care are the ones who get access.
Sorry, I just want to spontaneously see if there's a question from the audience. Is there? No? Yes? Do we have a mic? Do we have a mic runner? Yes, mic runner. May I steal this? Whoops. Two.
Hi. Oh, yes. I'm like, can I hear myself? I have a question about, I mean, I also see a lot of, like, it worries me, this thing of you being able to go to your primary care, just because there's other systems that work like that as well. So if you go in, like, in psykvården, psychiatry, for example, has some similarities in that way, that you first have to go to primary care to then get them to like refer you to the place where it's actually specialized, and that has caused issues constantly for everyone because it depends so much on the person that you meet, and even if they have the information about the fact that your role here is to listen to the person and then refer them, it very seldomly actually ends up like that. So I wanted to hear a little bit about, if you see any like warning signs within that, within it being like that, and in what way do you think that us as individuals can kind of navigate that? Maybe a massive question, but yeah.
Anyone?
I mean, that has been a huge problem, especially with young people and children, where you today in a lot of parts have to go through the children's psychiatry in order to get a referral to the gender clinics. And they want to like do their own investigation first and then keep you there for years unnecessarily because they don't have the competence. And I think it's I think it's a huge work around like educating healthcare staff and into like medical schools and keep like pushing the social or like the health agency, Socialstyrelsen, have a lot of like guidelines for primary care that I think it would be like that's a good act of activism to like give that to your vårdcentral, to the nearest BUP, remind them of like their role and like what gender confirming care is so they can like refer the right people to the teams.
Okay, Leo? Do you want to?
Yeah, it's a big concern of ours that everyone, no matter what age, will have to go through the psychiatry to get a referral. That is the latest proposal on what will happen because of NHB. Thank you. And we don't see how that will work if there are no like special cues into the psychiatry for just a kind of evaluation or something. We do see the need that the healthcare also are saying that people need more psychosocial support during the waiting time. That is a fact, and it is a fact that people are waiting and not getting this, and people, the health people don't, trans people don't always feel that good mentally because of the waiting and because of the minority stress and because of discrimination and everything, and also a lot of other stuff. And but we don't see that having to go through the psychiatry is a way. So that is a huge concern of ours. And especially in Göteborg, which is like what I know of, it's huge queues also getting into the psychiatry. So we don't really know what that will lead to.
Let's leave place for one last comment, and then I don't want to like, it's a very it's. I want you guys, queers, to visualize as well, like your visions about the trans healthcare. But first, I leave the word to Frank. Yeah.
Thank you. One thing that some regions do, I don't think Västra Götaland does it, but like for example Värmland, they have like a regional transgender health coordinator, and they are there to guide you through like, okay, who do I reach out to in order to get the healthcare? In Värmland, they're actually like a team now, so they also have like a counselor that you can go to while you're waiting in line to get to the gender clinics. You can like ask them for like, oh, where am I in the process, and like any question, and also like parents and other people close to you can ask them for support. And I think that's something that every region should have, and it's also a way to like they can have like dialogues with the gender clinics and like raise critiques and concerns that they hear from people. So that's something that I would really recommend that you advocate for, regional gender dysphoria coordinators.
Yes, Angelica, sorry, I'm just gonna, I want to go further because we just have 10 minutes to go. But So yeah, what I was saying, if we get to dream within our organizations, what our possibilities would be to change the trans healthcare system today, including intersectionality, including non-binary, including young trans people. What would be like your next step? Let's say for the closest 5 years, within now to 5 years. Yeah, Purdy?
Yeah, for us as intersectional trans refugees, first of all, we reiterate that through the Swedish Communicable Diseases Act, guarantees asylum seekers and refugees access to care that cannot be delayed, e.g. maternity, dentists, but transgender special health care such as gender affirming treatment is not recognized under the framework. This means that the essential treatments, which are often life-saving for transgender individuals, especially those facing mental health crises, are deprived. So that is like an immediate urgent issue. And we can all tell, even when we are talking about these amazing steps that the Swedish trans healthcare has taken, it is going to still be discriminative in so many ways when it comes to refugees, more so the undocumented trans refugees and asylum seekers, and being able to even like get into the system. So with these non-communicable diseases, if trans bodies, trans refugees' bodies are also taken in consideration that, oh, they need immediate health care, then that is what we envision to see happening as an organization.
I want to give the mic to Gabriel. Are you raising your hand? Yeah.
Well, you asked about what we could do, like in the short term.
Visions, yes.
Yeah, exactly.
Yes.
Within the next 5 years. However, I do feel that as a representative for Trans Health Platform, and I should take it a little bit further, and kind of just like generally discuss what our dreams for the future are. I think that with regards to NHV and the further centralization of care, it's very important to remember that NHV should only be seen as a very temporary step. And I mean, like, sure, like, it could lead to the teams being more consistent in care. However, the thing that NOV won't save and will never save is the waiting times, because as long as the assessment process exists, waiting times will always be a problem. Because obviously when you have such an extremely long and bureaucratic process, things will take time, and the amount of personnel and resources you would need to make up for that would be massive, and that is why Trans Health Platform is advocating for a decentralized model. Throughout this entire conference, many people have brought up the ethical problems with the assessment model. However, it is also worth bringing up the empirical problems with the model, namely that it is completely unsupported. Decentralized informed consent models have existed around the world parallel to the assessment model for many decades now, and they work. On the other hand, there is no empirical evidence that suggests that the assessment model is better at determining if you're trans or not.
Can I just stick in with one question? That so,
Yeah.
what would the next step be to from what we have today to decentralization? Like, can you see like the next?
I think that the next step. I mean, now that the ICD-11 has been translated and such, and being transgender is starting to be moved out of a more pathologized lens. I think it's important. I think that some of the best rhetoric we have is that requiring an assessment on transgender people is downright unethical because you cannot require an assessment on something that is not pathological. So, for example, you could also use the rhetoric that we have models within Swedish healthcare that are fully based on the on the individual's autonomy, namely like the access to abortion rights and contraceptives and such, and the fact that we continue to require assessments on transgender people is downright hypocritical. So,
Thank you, Gabriel. I would need to interrupt you there because we have 5 minutes to go, and I haven't let Helen, Max, Angelica, and the others talk. So I have to share out the word, and I know you raised your hand, so go ahead.
Yeah. Do you hear me? Yep. I'll try to make this short. Except from the self-determination that I would very much like to happen in the next 5 years. I don't see it as maybe very plausible, but we also want to, in Sveriges icke-binära, to see a third legal gender, and that also like seen in the medical care. Even if there are some doors that have opened, we don't see like a recognition of any kind in the laws that have come. We want to stop the limitation or denial of trans healthcare on unrelated grounds like mental illness or neurodiversity. That is a big question for us because we have a huge overrepresentation of neurodiverse people. Yeah, as some other people have said here, depathologize the trans condition and treat it more like a condition that requires healthcare, like a pregnancy or something like that. Maybe not in the next 5 years, but we want to destroy the general view of gender and really see, yeah, thank you, and not see that in like the medical, how you treat people or in the laws, because it's not really relevant for the most part. Thank you.
Thank you. I will give the word to Max.
So I think what a lot of what we've been talking about today boils down to is the balance between accessibility and quality in the care and competent, educated healthcare professionals. So I think a big first step is like more financing and more staffing to the teams, not just to cut the queues, but also so the teams themselves have time and ability to develop their competence and further education in intersectionalities and non-binary identities and so on. Because there's really no use in making a really, really accessible system if the treatment itself is not good and will make you worse. So big first step is financing, staffing, and competent, educated professionals.
Yes, we'll hold it really quick. So because we just have 2 minutes left, so I'll give you 1 minute. Is that okay?
Yes, there must be set up more assessment teams. So you split the medical side from the assessment side. But things being what they are, the regions can give a little more money to, but there are no people who apply for the jobs. That's the problem. How to enhance the staff with, and it must be. It must be made more interesting to work in this field, and it starts with this psychology, psychiatrist education, I think. And there's a lot of things. The money isn't the matter. It's manpower that matters, and that's a big problem.
Thank you, Angelica. And the last word to you.
Yes. For us, it's very important that young trans kids get included in these conversations, just in general, because adults talk about children and not with children, and that stops trans kids for just in general getting their needs and rights met. So a very concrete thing that we in Save the Children Youth wants is for trans kids to kvalitetssäkra, make sure that the quality for trans kids, that they decide and take the lead on their own care. So a very concrete thing. Yes.
Thank you. We have a short of time, and I want to thank you all panelists for this conversation. I know that the conversation has been a bit short, and don't let the discussion stop here. See it as I think we just started the last quarter to get somewhere. So I'm a bit frustrated, but please continue your conversation after this panel. But now we have to leave space to someone else on the schedule, Adrian and Maria. Yeah. Theo? Yeah, okay. Thank you. So thank you, panelists. Thank you.